So I just want to say good morning to everyone. Thank you for joining us today. My name is Jack McDougall. I'm President and CEO of the Greater Washington Board of Trade. Since the onset of the pandemic, the Board of Trade has hosted more than 30 of these virtual webinars as a way to share expertise and gain new insights. Things are evolving every day, as we all well know. I'm really pleased that nearly all of the Board of Trade's members and organizations have participated in these briefings. That's a real strong testament to the value of the Board of Trade network. And I really want to thank everyone who has participated as a speaker, a sponsor, a listener, and a contributor. You know, we all know that the recovery from the health pandemic and economic fallout will take time. We also know that life after will evolve in many unforeseen ways. But still, we're eager to get back to some sense of normal. You know, especially now with the holidays approaching, family gatherings just aren't the same over Zoom. Recent headlines about vaccines in particular seem very promising, but should we get our hopes up? What's really going on here? And our panel today will help us explore the current state of play and where things are going from here. So I'm excited to learn more and hear what they have to say. First, I'd like to welcome our presenter and moderator, Dr. Puja Kumar. She is with McKinsey, a physician by training. She serves health systems on large-scale performance transformations, as well as on growth and partnership strategies. She's worked for public and private sector institutions, as well as not-for-profit and for-profit health systems. Pooja leads McKinsey's work in academic health systems and leads the firm's knowledge development on patient access and ambulatory operations. So today she's going to facilitate a conversation with our panelists, and we're really pleased today to have Eugene Laney, Head of International Government Affairs for DHL Express USA, Dr. Lisa Maragakis, the Senior Director of Infection Prevention at the Johns Hopkins Health System, and Dr. Samir Balile, Clinical Pharmacy Program Manager at Giant Food. A really great panel, and we'll have a lot to say. As a reminder, if you have any questions during the discussion, please use the Q&A box, and we'll get to as many of those at the end as possible. And so with that, I'm going to turn it over to Pooja, who's going to set the stage for us, and then start our conversation. So thank you very much.
Great, and thank you, Jack, for the introductions and for having me here today. Thanks everyone also for joining. I thought I'd start by setting a bit of the context for why this vaccine is important and what is important for us all to know as employers and frankly as members of society about the upcoming vaccine and what we can do to prepare our population for it. Again, if you have any questions during this panel, please submit them through the Q&A function. Next page, please. So to start off, I think it's fair to say that the COVID vaccine is unlike any other effort that we've undertaken in recent history, both in terms of development, but also in terms of the challenge it poses for the logistics of scaling up the administration of the vaccine. And there are several reasons for why it is different. The first is obviously the pace of the development. We are seeing vaccines on the brink of being approved through the FDA's EUA proposal process right now. And the timelines that we're seeing here are 4 times faster than any other vaccine development effort that we've seen in modern history. The second issue is that the scale of what it will actually take to get this vaccine out is, the aim is for it to be about 4 times larger than any previous effort. And that's really if we tag it to another adult vaccine like influenza, given the uptake that we normally see, the lower uptake that we normally see with influenza, the higher uptake that we are hoping to see with something like a COVID vaccine, given our goals to reach some level of immunity for the population, and the fact that several of the leading candidates require 2 doses in order to be effective, at least at this point. The complexity of the effort is also massive, and there are a few reasons for why it is more complex than prior efforts that we've seen in recent history. First reason, there is the potential for multiple manufacturers to be on the market at the same time. And we don't want to be in a situation where patient A is getting, manufacturer A for the first dose and manufacturer B for the second dose. So how do we actually ensure that folks have access to products that they would like, but also that they are able to get both doses of the same manufacturer? The second is that every technology right now out there has different protocols in terms of administration, transport, storage needs. I'm sure many of you have heard about the ultra cold storage needs for the Pfizer vaccine, and different kind of needs for each of the candidates out there. Not to mention the potential for either real or perceived differences in safety and efficacy that might change consumer uptake or attitudes towards any of the given products. And then finally, two really important things at the bottom of this page that I want to ensure that we spend some time calling out. The first, as Jack alluded to, is the importance of the vaccine to protecting lives and livelihoods in our country and our economy. And then the second is the importance of this vaccine for health equity. We've already seen the disproportionate impact of COVID as a disease and the mortality due to COVID on different parts of our society, and the inequitable impact of the disease. Conversely, I think that we will have great challenges in ensuring that there's equitable access to the vaccine for populations across our country, in ensuring that folks can get the vaccine that they want when and where they want it. So I think this poses a real challenge to all of us and all of you on the phone as employers on how everyone can play their part in ensuring that all of these factors are addressed. Next page, please. So why is this vaccine important? I think what it comes down to is the vaccine going to help us get society back to herd immunity quickly? Will it be one contributor? Will it be the major contributor? And how do we actually ensure that it can be the tool that helps us get back there and allows us then to get back to the next normal of our lives? This page is a little bit complicated, but what it tries to lay out is the amount of coverage that we will need in the population as seen on the x-axis, depending on the efficacy level of the vaccine candidates that are on the market on the y-axis here. So many of you are probably tracking some of the recent news around the efficacy, the initial efficacy data for both the Pfizer and the Moderna vaccines that look to be both in the 90% range, which frankly, I think several of us who have been looking and tracking these vaccines would have thought is our best case, unbelievable wish list. And if we're looking at an efficacy rate in the 90s, in the high 90s, the level that we'd have to achieve in terms of coverage of the vaccine or uptake of the vaccine is in the 60s, which is significant. Influenza every year is less than that for adults, and that's a single dose vaccine. If there ends up being lower efficacy of the vaccines that eventually come on the market, or the total mix of all the manufacturers that are out there are in some lower, then we actually have to achieve even higher coverage rates than that. So all to say that this is a big challenge in order for us to actually be able to achieve the levels that we might need to get society back to some normal. Obviously, efficacy or our ability to reach herd immunity is also impacted by what underlying immunity might exist already in the population, whether there's cross-reactivity with prior types of coronaviruses, or whether, frankly, people who've already had the disease maintain some immunity. So that will impact it too. But regardless, I think this will be a big challenge for all of us collectively. Next page, please. Jack alluded to this, but maybe just a quick data point here. The vaccine will be an important tool for us to get back to normal, and this has a massive impact on our economy. In modeling that we have done looking at global GDP, we predict that there is a $25 trillion difference in cumulative GDP loss between these two scenarios that you see on this page, A1, which suggests a slow long-term growth and muted recovery, and A3, which suggests the virus being able to be contained relatively quickly with a return of growth. That is massive on a global scale. It is also massive on any regional or local scale, including yours, in the health of our businesses and our economy. So again, just another reason for why, and putting it in the context, putting it in an economic context. Next slide, please. As you all know, several developers have already announced the potential for emergency use authorization imminently, with both the Pfizer and Moderna announcements recently suggesting, and the press suggesting, that we're looking at a potential December authorization, although final dates are still to be laid out based on the FDA's timelines and the timelines of submission. But there are several other candidates also out there, and also looking at similar Q4 2020 and Q1 2021 timelines. All of this suggests that it is already on our doorstep, as I alluded to, and a lot of planning is already in progress, and it will require all of us to participate in order for the planning to go seamlessly. Next slide, please. Many of you also know that the doses that have been secured in advance by the federal government are, the federal government has already secured 800 million doses across every manufacturer that is in late stage trials right now, to provide at no cost to every American. Now, we're not expecting that all of these 800 million necessarily will come through phase 3 trials and through EUA, but that being said, there are several doses that are already there on the brink of approval and purchase. And without a plan to actually get these out, I think there is the potential for several vaccines to go unused or to delay our ability to reach herd immunity more quickly. Next slide. This just gives you a picture of all of the steps that need to come together in order for this to work. I'm not going to talk about each one of these steps in detail, but suffice it to say that there is a role for likely every single one of you on the phone today and your companies in how to help smooth the process, whether it's around logistics and manufacturing, or last mile logistics, or actual administration at the point of care, or frankly, all of the IT systems that need to work in order to track and ensure appropriate delivery, and then all the way through to patient adoption. I can't think of a single employer that I've had a conversation with to date that has been untouched by this planning in some way, and I imagine that many of you are deep in it as well. So I wanted to end this front section by just putting up a few themes on the next slides for how we're seeing different organizations consider preparation for the rollout. Some of you are involved in thinking through which segments of your population may be more amenable to the vaccine in earlier stages in compliance with the CDC guidelines. You know, who is more high risk? Some of you are involved in the various parts of the dispensing value chain. Some of you are involved in thinking through funding and reimbursement needs that will occur because of the administration of the vaccine. And then likely all of you are in some way involved in employee communications and messaging and education. I will say that given the amount of information, misinformation and disinformation out there, the communications and preparations of kind of communication and stakeholder management of this is going to be a massive task as well. And I think particularly for employers as one stakeholder. So with that, I am going to pause this first section and briefly reintroduce our panel, and then open it up to questions, which I will begin with for our panel. So I'll ask each of our panelists to come on camera at this stage and just quickly go through each of them in turn. Lisa, as Jack mentioned, is the Senior Director of Infection Prevention at Hopkins Health System. In this capacity, she's responsible for conceptualization, planning, implementation, and development of the health system's infection control and prevention program. Today, we'll be asking her about the development of the vaccine and health system preparations. Eugene is the head of International Government Affairs at DHL Express USA. In this capacity, he ensures corporate compliance with regulatory requirements and tracks international trade and cargo security issues. For our purposes today, we're going to be asking him about the logistics of the vaccine rollout and delivery. And then finally, Samir serves as a clinical pharmacy program manager for Giant Foods. We'll be asking Samir today about the logistics of the last mile vaccine delivery and what's really involved in getting this vaccine to the public. So Lisa, I might start with you first on preparing for the vaccine. Can you tell us a little bit about how you at Hopkins are preparing both for this next surge of cases as we work towards a vaccine being available to the public, and then also how you're thinking about the vaccine with that backdrop in mind?
Sure. Thank you, Pooja. And I'm so happy to be with everyone today. This is a really sobering and frightening time for us in healthcare. We see modeling and data that are showing us that the wave that is about to crash over us or in certain parts of the country has already um, uh, begun to really stretch healthcare capacity. So that is our primary undertaking right now, is preparing for the surge planning, making sure that we have the equipment, the beds, and most critically, the staffing in order to absorb the anticipated numbers of patients with COVID-19, while still maintaining our clinical operations to care for patients who have other medical conditions. So this is job one for us right now, and it is a daunting one. Along with that, of course, we are focused, as you've said and outlined so beautifully, we have a chasm in front of us before we get to the vaccine. So although this news is so hopeful and wonderful, a light at the end of the tunnel, so to speak, we have a long way to go between now and then. And facing significant challenges. So we are focused, as we wish everyone in the country would be, on the basics of infection prevention, which we all have heard ad nauseum about: masking, physical distancing, hand hygiene, avoiding gatherings. We are pushing these messages with our own employees because we, as I mentioned, staffing is a critical concern, but we are seeing increasing numbers of call outs and illness amongst our own personnel, largely, I must say, due to community exposures, not because of their healthcare exposures per se, but all of the same ways that everyone in the community is getting the virus. So we are laser focused on strategies to maintain our workforce. With regards to the vaccine, of course, as I said, it's very encouraging and wonderful news to have this. And we are in the process of deliberations for how to prioritize vaccine administration. Of course, healthcare workers are in most of the frameworks from the National Academy of Medicine and others at the top of the prioritization list, but we have a lot of work to do within our organization to figure out not just the logistics of distribution and delivery, but also how we're going to prioritize what we expect to be fairly limited supplies at the beginning. So I think I'll stop there, but we have daunting challenges ahead, and we certainly hope everyone will get their flu shot, which we do have available right now.
Thanks, Lisa. Eugene, can you speak about what you and DHL are doing to prepare for the vaccine, and how has recent news from Moderna and Pfizer changed anything about your planning, if at all, in terms of timing or requirements?
Thank you again for having me on here. This is a great program. It's interesting that today we have an opportunity to prepare for the vaccine distribution. We didn't have that same opportunity in March. And as I sit in my office and I see the calendar still has March 2020 on it, it's interesting that we're in a tough place now. So we've learned a lot about how to prepare based on what we learned from the PPE crisis that we had of trying to get PPE distributed. So it really falls along three areas. One is there has to be coordination between our partners. So we're working a lot with some of the pharmaceutical manufacturers. I can't list who we're working with, but we're working with a number of them. And what we're trying to do is we're working along three areas. So one is the sort of time definite approach. And that's the idea that trying to get the vaccine into places where there's an enormous outbreak. So that's sort of like the next day approach, time definite. The other approach is sort of looking at how we can forward the vaccine to particular warehouses, whether it's in Latin America and Africa, or whether here in the US. So that's sort of, our restock sort of approach. And then the third is sort of trying to be integrated into the pharmaceuticals manufacturing process so that we can help them, restock, resupply, do just in time, all of the other areas that I mentioned before. The other two sort of areas that we're working on is logistical challenges. What we learned from PPE is that we had issues with capacity. When I say capacity, we have another job besides moving vaccines. We're moving a lot of e-commerce we're moving stuff for, some of the large multinational corporations. So just having the capacity to be able to move these goods and also move the vaccines is what we're focusing on. So getting access to markets, getting access to particular airport slots, those types of logistical challenges, moving through cities that may not have adequate infrastructure. And then the last thing is the regulatory challenges. So what we learned through PPE, that there were a lot of FDA requirements, there are a lot of state and local requirements, a lot of customs border protection requirements. And so we're trying to work a lot with those groups to sort of ease some of those restrictions, and particularly in this area because we're dealing with a vaccine where product integrity is so important. So now dry ice that's needed for the vaccine is considered a dangerous good. So we have to deal with a lot of state and federal and local regulations around that. So those are sort of how we're, broadly preparing.
Thanks, Eugene. And Samir, we'd love to hear from you, from your perspective, both as a pharmacy manager and as a retailer. What are you all doing to prepare for the vaccine?
Yeah, thank you so much for having me on the call today. I think being a pharmacist, but also being a pharmacist inside a grocery store has proved many different challenges. Of course, the grocery side of the business has been very busy, but in preparation for the COVID vaccine and how we're going to administer it, there's just so many unknowns. I think when I was preparing my notes for this, I thought of an analogy, and it was kind of like, we're told we're going to be hosting a dinner party, but we don't know how many people are coming. We don't know what time they're coming, and we don't know what we're serving. So, but we know we're having a dinner party, I think is the best way to kind of analogize that. But there are many uncontrollables, but as far as controllables go, what we've done in the meantime is made sure that all 153 of our pharmacies have functioning freezers that are able to obtain the proper storage temperatures. We've also made sure that we've secured proper PPE, such as face masks, face shields, and medical grade gloves. We've also made sure, specifically during this flu season, there was a significant shortage in the ancillary supplies required to administer vaccines, such as needles. There was a shortage of those earlier this season, alcohol wipes, Band-Aids, and sharp containers. So all of these products had supply chain issues when we were heading into our flu peak administration season back in September, and it's still going on now. So I think our mentality going into this, until there's more clearer direction, is just check all the boxes that we can, and in the meantime, we'll wait for more communication from the State Departments of Health.
Thanks, Samir. And I'm going to start using that analogy. It's a great one. Eugene, maybe back to you on what do you see as the biggest risks or challenges from a logistics perspective for the vaccine?
Yeah, so I think Samir is helping us with, we're going to use his analogy throughout this whole thing. I love it. So just imagine if you're having a dinner party here in Washington, D.C., and all of your food has to come from Wisconsin and only from Wisconsin. And so using the PPE example, we had when we were moving PPE, we had the huge challenge of moving PPE from China in the midst of a China-US trade war. So you had a China-US trade war, you had challenges at the border, and then once you got the products inland, you then had to try to move it in particular cities, and it was only coming in certain areas. So one of the geographical concentrated production is going to be a big challenge for us. The idea that it's going to be produced in one particular area, and we're going to have to then move it to a warehouse, and that warehouse may only be the main facilitator for a number, maybe 3 or 4 states. So we have to think about that, like how to manage, the geographical concentration of the production. The other part, as I noted, one of the biggest challenges we're going to have is that if the drugs come out at the end of this month or in December, that's also the holiday season. So that's our peak season. So that's when everyone is ordering e-commerce and things on Amazon, eBay, and Etsy. And so we're going to have to balance, the demands of e-commerce, the capacity around that, as well as trying to balance out, the vaccine distribution. And so that means that we're going to have to hire new drivers. We're going to have to get new planes. We're going to have to get new access to some of the airports. So all of that has to be considered. And then the one big thing that I think globally that we're really looking at is the product integrity piece. Is so critical because we've been fighting for a number of years to help Latin America and Sub-Saharan Africa and other places that have the kind of cold storage to be able to keep vaccines and other things that are important for health and safety. And so now we have to figure out how to build up that capacity by having huge refrigerators in different parts of the country and the globe to sort of care for these vaccines when they get there, because product integrity is critical. If we get the vaccines there and no one can use it, then they're useless. So those are the challenges that we see.
Thanks, Eugene. And maybe to ask that same question of Lisa and Samir in turn, what do you all see as the biggest risks or challenges from maybe an administration point of view?
I can just speak on behalf of the healthcare system. You know, I think some of the things that have already been mentioned are significant logistics challenges, especially the cold chain piece of it, and needing to ready ourselves, as others have said, with not full information really about what we are facing. I also think that it's a little challenging, well, it's very challenging in the current environment, because there isn't the usual coordinated federal and state response to really inform us about what are the plans for who is going to distribute the vaccine. Of course, the timeline is uncertain as well, but you know, the dinner party analogy is apt, although I have to say we're discouraging dinner parties right now. But it's really a challenge to plan in this information vacuum and without a coordinated response across the public health sector.
Yeah, I think what's most important is kind of identifying the population groups who are most vulnerable to contracting COVID. That should be a first priority. But I've been working closely with the different departments of health, Virginia, Maryland, DC, Delaware. And I think the approach that they're taking is going to be a tiered response, but it will also include identifying potential hotspots in our communities. And they're trying to ensure that the vaccines get to those who need it the most. And then I think they plan to work their way out from there. But another thing I thought about was also the platform in which these vaccines will be administered is also very important. This year, we kind of thought out of the box, and we utilized a mobile Airstream clinic, which allows us not only to provide immunizations in a safe environment, but it kind of also helped put our patients' minds at ease. And in addition to that, it also allowed us to reach areas that really need these types of services if they are unable to get access to a store or don't have access to these types of services. So if an individual was not able to come to us in the pharmacy, we were able to go to them and address their concerns of potentially contracting the virus, but also addressing their other non-flu and flu immunization needs.
That's great. Yeah, bring what the needs are to the communities that need them. That's great. We have a question from the audience that I'd like to maybe go Lisa and Samir also again to. What can health departments and community organizations do to help prepare the public for vaccine distribution and uptake, especially given lack of trust in certain communities?
You know, here is where I think public-private partnerships are so important, because as Samir alluded to, we really need to identify the most vulnerable populations and start working now to reach out, provide accurate information, answer questions, help to overcome vaccine hesitancy, and also identify the logistics of how to distribute and administer the vaccines to those who need it most. I think community partners are critical in this endeavor. And Johns Hopkins Medicine is certainly partnering with our community partners, both the city and county and state governments, but mostly the community leaders who know where these communities are, they know what their concerns are, and they are trusted sources of information and influence in the community. So that will be a critical step.
Yeah, and I think that goes hand in hand with the annual flu shot. Of course, this year, more people were seeking the flu shot, but that vaccine hesitancy that that Lisa was talking about is a real thing. And I think debunking those myths and addressing those concerns and having that level of transparency, but also communicating the importance of getting immunized is so important. And that's something that has to be very grassroots, in my opinion, and reaching out to those community leaders and having them communicate that clearly as a trusted member of their community.
That's great. And then beyond communication, are there other things that employers should be doing, even if they're not community organizations necessarily, to prepare for the COVID vaccine? And I would love to hear your view for both employers who have, potentially staff who might be considered to be essential staff in the community, but also those who don't. Sorry, Samir, maybe we start with you for that one.
Yeah, I think with a majority of our employees being in the grocery business, that they are customer facing, as well as our pharmacy staff who does have direct contact with patients on a daily basis. So it's very important to communicate, I think, with the workforce. And I think a lot of it lies in education. Specifically for my pharmacy teams, giving them the tools they need to make that recommendation with confidence to their patients and address any vaccine hesitancy issues that the patient may express. It's sometimes as simple as giving them talking points and providing them the benefits or letting them know of the benefits of getting the vaccine. I think one of the best tools that I utilized was when I was trying to encourage my patients to get vaccinated, is telling them that it's not just about protecting yourself, but it's also about protecting their loved ones, family members who may be immunocompromised, elderly patients in their family or elderly family members. So I believe that from an employer perspective, providing educational resources to your employees is very important, and having those conversations of the importance of getting immunized. And then also making sure that those resources are effectively communicated to empower their employees to make the decision that's best for them and their families.
Great, thanks, Samir. Maybe a question, slightly changing tact here. Several questions around the difficulties of certain aspects of the vaccine, and maybe Eugene, question for you. Can you talk a bit about the technology implications around distribution of cold chain, for especially the cold chain monitoring component? And is there sufficient infrastructure in place to achieve cold chain monitoring throughout the last mile, to the last mile? If you can comment on that.
Well, I wouldn't be the expert on this, but we have a innovation center that's located in Chicago. And so even before this pandemic, it's always been our goal to sort of work with a lot of our pharmaceutical companies to try to address the cold chain issue, mainly because DHL is one of the first, logistics providers, in sub-Saharan Africa. So it's been a huge issue, around malaria and other, diseases that we've tried to figure out a way to, facilitate the movement of those vaccines. So we've always been forward thinking in how to use AI, blockchain, all the technology that is out there. And even, in some places, we're trying to get some of the governments to adopt something simple as, removing the paper process to get certified to bring a vaccine into the country. So most people don't think about that, but many countries are still in a paper process. So you can imagine that, getting back to product integrity, that vaccine is sitting there on a tarmac, waiting for all this paperwork to be to go through, for customs to go through, and then it dies on the tarmac. So we've been working really hard to create single window processes so that a lot of countries can expedite the clearance of vaccines so that it can get to the final get to that last mile. That's a big piece of it that I don't think a lot of people imagine when vaccines are imported in.
And Samir, any thoughts on this from your perspective at the last mile?
Sorry. Yeah, so a lot of the from a cold chain supply perspective, working with the departments of health, it looks like they're going to only ship to one certain location in the state. for example. So if we have 153 pharmacies, 88 in Maryland, they would ship to one specific store as they're allocated the doses from CDC, then those doses will then sit there. So when you're talking about storage and transportation issues and moving those supplies specifically for the deep freeze that is on dry ice, and it's only good for 5 days on dry ice, the container can only be opened twice a day for that time period. So moving it along and getting it to those communities that need it the most, it does pose a huge logistical problem.
May I raise one other thing we haven't talked about yet, and that is that both of the candidate vaccines that we expect to come onto the market first, to get approval first, require 2 doses. And we are familiar with this for other infectious disease prevention vaccines, but it is a logistic challenge, especially when you have different formulations of a vaccine for one disease, and you will need to make sure that an individual who is vaccinated comes back and gets the second vaccine with the same type of vaccine that was given the first time around. And this could become, of course, even more complicated when we have more and more types of vaccine. So just wanted to raise that. And it requires planning if we're doing prioritization and we have limited amounts of vaccine, that really once you make that commitment to vaccinate somebody, you need to have the second dose available.
Lisa, how are health systems like Hopkins thinking about that, and any asks that you would have for employers on this second dose issue?
Well, we are certainly, as you can tell, thinking about it a lot in our planning, it impacts the number of people that we believe we can vaccinate, of course, with any given supply. You have to kind of cut it in half to figure out how many people you can vaccinate. But again, we don't quite have all the information that we need, but I think it will need to be a partnership for education and messaging. And again, that it gets back to the theme of hesitancy and making sure people will have questions about which one is better and should I get both? And, so providing information, answering all of people's basic questions is going to be very important.
We have another question from the audience regarding, the 2 candidates that are the leading candidates right now for the press and timelines that we've seen. Both the Pfizer vaccine that requires the ultra cold freezers, and then the Moderna one that allows normal refrigeration. The question is really around how will that affect uptake of the vaccines and logistics, right? Will folks still be using both, or how should systems be thinking about having 2 that have such different requirements? Lisa, maybe start with your perspective, and then would love to hear from the others as well.
I'm sorry, can you just frame it again so I'm sure?
Yeah, sure. The question is, given there are such different storage requirements for the 2 vaccines,
yes,
is that going to change the uptake of a health system or a provider of being able to provide one versus the other?
It certainly is less of a challenge for the cold chain. So I would anticipate from our standpoint that it would potentially impact that. But of course, we have to look at other factors as well, like the amount that is available. And I anticipate that at the beginning, we're going to need to plan for both so that we can maximize our ability to protect our workforce and our patients. So I'm not sure really, it might, if they both came out at exactly the same time, of course, there would be a preference for the one that's easier, but I think we probably have to plan for both.
I'm seeing some nods from the other panelists. I imagine there's consensus on that point.
Yeah, I would think, and it was interesting to hear Lisa's, I hadn't thought about the double dose impact. So then the question becomes, do you just use the one that's easily refrigerated for just in time or time definite, or if there's some kind of immediate issue, and then you use the other one for maybe long-term, storage or for, trying to address issues that, are going along, a different, longer period. So I think for us, we would probably, we're prepared for either direction, either the time definite or it's sitting there. But, the cold storage piece is a huge challenge. I mean, Samir hit it right on, because if you can imagine, if that warehouse, he just used the example of here in the Washington, D.C. area, but if you can imagine if the warehouse is only in, let's say, in Ohio, and that warehouse has to supply, Kentucky, Indiana, and Michigan, that could be a huge logistical challenge.
Yeah, and then to just kind of add to what Lisa had mentioned, another part that I didn't discuss earlier was working with the state registries for vaccines. So what we've been doing, and for the COVID vaccine specifically, they've also requested that we report certain additional patient demographic information. And unfortunately, our current prescription processing platform does not collect that information on their electronic medical record. So we're looking at vetting another platform that would automatically report when the patient got their first dose. And then reporting can be run. And then of course we have different tools that we can use, whether it be like on-demand texting, robocalls to reach out to those patients, having them come back for the second dose. But that is another part of this that I kind of didn't talk about, was the additional reporting that the CDC is requiring, and working through that challenge as well. So yeah.
Yeah, there's actually a question from the audience around the issue of reporting and medical records for people who get vaccinated. Where does the information go? How does this work if there are people administering vaccines who are not established medical providers? Maybe Samir, anything else you would add on that piece?
Yeah, so currently Maryland and Virginia have bi-directional registries for vaccine administration. Unfortunately, the other states that I operate in don't. So it's kind of difficult to have that transparency. Like, for example, if I was the one to provide your first dose, but you go to a different provider to get your second dose, there's not that transparency between the two providers for that second dose administration in those two states. So working with the registries to make sure that reporting is done and that all of our pharmacies have access to them is very important. Another part of the equation.
Thanks, Samir. Lisa, maybe switching tacks a little bit. We have a couple of semi-clinical questions, and feel free to tell me if you can't answer these. But the first is around once the vaccine is received, what precautions should people take, if any, if we know that?
So this is such a great question, and I'm afraid people are not going to like my answer. But right now, our recommendation is that even after natural infection or after vaccination, that for at least a while, we need to continue doing the same infection prevention precautions that are recommended right now. So again, I know that's going to be disappointing news, but we've been trying to message that a vaccine is not a panacea. We need to know more about the duration of immunity. We need to know more about what exactly natural infection and or vaccination prevents. It is possible, for instance, that the immune reaction to either natural infection or the vaccine is quite effective at preventing severe disease or hospitalization or death from the disease. But there is still an open question about whether an individual could still pick up the virus, carry it, and transmit it to others. So for now, while we're trying to flatten the curve and interrupt transmission, our recommendation is that everyone continue to wear a mask and practice physical distancing, hand hygiene, and other measures.
And for employers on the phone, what would you suggest in terms of how they communicate about, what the vaccine will allow employees to do?
Yeah, this is where, I think partnership amongst all of us who are willing and able to provide sources of trusted, accurate, timely information, and just keep answering people's questions and providing information. It's very important to also let people know that this is a rapidly evolving situation, and to fight against some of the mistrust that comes when they hear one thing 1 month and then the guidance changes. And that's because we get more information, we get more data, or somehow the situation has changed. So my hope would be that we could all get onto the same page and start amplifying some of these messages, the main ones that we're talking about today.
Yeah, that's great. Thanks, Lisa. And maybe a slight variation on this, just again, thinking more long-term, what do you see as the long-term expectations for the vaccine? And should we expect to continuously receive the vaccination annually going forward?
Yes, so this is one of the big unknowns that we just don't know yet, how long the immunity will last. Of course, some types of vaccines for other infectious diseases, are one and done, or maybe need a booster, after 10 or more years, but we don't know the answer yet for these vaccines. So I think right now we need to take information as it comes and view this as just such a wonderful tool that we will add to the tools that we already have in our prevention toolbox that we're using right now to get to the vaccine. And then we have to cross the enormous challenges that we're discussing on this panel today about distribution and vaccination. And then we will begin to get more information to answer the question that you're posing. Is this going to be an annual vaccine? Will it last for 3 years, for 5 years or more? And how that might vary across the different types of vaccines that may become available.
Thanks. Another question on reporting. Are employers required to report the number of staff who've received the vaccination?
I'm not sure. I guess depending on the provider who administers it, the administration's automatically uploaded to the state registries. But as far as from an employer perspective, I'm not sure.
Okay, that's fair. And I think every state is actually determining some level of this themselves right now, so it likely varies from geography to geography. Maybe stepping back to one of the issues that was raised earlier around the supply chain. And Samir, you referenced the lack of ancillary supplies, or the kind of running into that situation for flu. We're hearing about a national glove shortage right now overall as well. A question from the audience in regards to supply chain, do we have the necessary PPE and supplies that we need? Maybe I will break it up into two: A, for vaccination, and B, for this next wave that we are seeing. Would love to hear about it from each of your perspectives. Maybe we can start with Samir, and then Eugene and Lisa.
Yeah, so I guess I can speak to my organization and what we've been doing. There was a lot of issues securing. BD had shortages on needles. I had submitted a huge allocation back in July, and it still has, just to give you guys perspective, it still hasn't hit all of my locations yet. So it's slowly kind of trickling in as they're trying to ramp up production to meet the increased need for the needles. And these are the needles that are used for pre-filled syringes, which is what that we're anticipating at least one of the vaccines is going to require. But as far as our organization, I can speak to gloves. We are in a good situation. It was a scramble earlier in the season just to make sure we had enough, anticipating a potential COVID vaccine early next year or at the end of this year. So we are in a good situation, I can say that, for Giant Food and Giant Pharmacy.
Eugene, any shortages that you guys are seeing or planning for in terms of PPE or ancillary supplies?
Well, to separate the two. So the PPE issue, it was a huge peak. In other words, it was a huge spike where there was a lot of demand, and then it sort of leveled off because there was a lot of domestic production. But My concern, and I think our concern globally, is that you may see that spike again as you've seen other countries go through their second wave. And so what we worry is that eventually what will happen is this sort of nationalistic approach where countries will say, well, I've got all the PPE production, I'm not going to let it out of my country and allow you to have it. So we saw that a lot, and we fought really hard to try to prevent countries that were producing PPE from stopping, from leaving their country. The other thing I don't think that we've talked a lot about is defining what is certified or FDA PPE. And so one of the biggest issues we had, like the first 2 months, was all this illicit trade and counterfeit PPE that was coming in. And so I also worry about, will we have the same issue when we get down the road with the vaccines? Because, there are a lot of people going to be looking for this, and they're not going to, outside of their employers or outside of, a healthcare provider, they're going to go out there and try to find it. And there's going to be a lot of illicit trade. And that's why it's so important for employers to try to identify a trusted source of supply, as well as educating, their employees of the risk of counterfeit, PPE or counterfeit vaccines that might come in. So those are the two that concern us: the spike as well as illicit trade.
Thanks, Eugene.
I can just add a couple of thoughts to that. I think Eugene and Samir have explained it very well, but I'll just say in the healthcare facilities, changing from one product to another does have very real world consequences. You might not think about it and think a gown is a gown, but as Eugene outlined, we need to make sure that it's acceptable from a fluid resistance standpoint, that it is approved for medical use. And the design differences cause procedure differences. So we have to do full education campaigns, with our employees and training so that they can don and doff that type of gown properly. And each design presents unique things. We tried one yesterday that had a preformed hole to pull over your head, but we're wearing papper hoods and the hole won't fit over the hood. So, solving issues like this becomes an issue. And then I wanted to speak for a moment about what Eugene alluded to, and that is the very difficult marketplace of counterfeit. Navigating this, and not just counterfeit, but the complicated situations that arise. Some of the products coming in from China have come through our normal distribution channels from big distributors. But when we open them, and we're ordering them as an organization under the same product numbers, but we open them and find little cards in them written all in Chinese, except a little note on the bottom that says not for medical use. What does that mean? It looks like the same thing. And, so far the distributors have been able to work with us on that. But we have some suspicion that may be what Eugene was alluding to, that it may be a technique of manufacturers in China to be able to get the goods out of their country, but that puts us in a bind. So it's very complex and not much better than it was in the spring.
Wow. Yeah. Huge issues to worry about across the board, I think, and in some ways, even more, right? As some of these security issues, especially around the vaccine, heighten some of the risks that we are already seeing. I know we only have a few minutes left, so I wanted to do a bit of a step back and actually ask maybe Lisa first, in your role as both a clinician and looking at the epidemiology of this, how would you think that the advent of a vaccine affects the spread of the virus in the coming months, if at all?
So I think the answer to the question depends on everything we've been discussing today. So if we have a coordinated distribution plan and administration plan, if we can address the education needs and the vaccine hesitancy issues and really get broad uptake of the vaccine, and if the supplies are adequate, then it will be tremendous news and should of course accelerate the ability to achieve some degree of herd immunity to interrupt transmission of the virus. So a mass vaccination campaign would be fantastic, particularly given the stellar data that we have seen about the effectiveness of the vaccine. So that's our hope, but all the significant challenges we've discussed today stand in the way, and I think it will depend largely on how well we can address those issues.
And then, with that as a backdrop, right, where we might be facing this rising tide, we are facing a rising tide, I think, across much of the country, including your geography right now. Eugene, or maybe Samir first, how are you communicating or to your customers about protecting their health during this time?
Yeah, I mean, I think what COVID has what COVID has done, it's made everybody more aware, I think, of their overall health, and we're seeing that people, I think, want to take more ownership of their wellness goals. I think as people are trying to minimize their exposure, our pharmacists have been working hard to kind of address all of their clinical needs at one visit, right? So patients may only be coming in once every 90 days now. So we need to make sure that we're addressing any adherence barriers that they may be experiencing when managing their chronic illnesses to prevent them from potentially being hospitalized for an exacerbation of that condition, and allowing those resources to be available for other maybe more sick patients with COVID. Also providing immunizations. I think this year has been so busy from an immunization administration standpoint, whether it be pneumococcal, shingles, and flu, of course. I think with 90% of Americans living within 5 miles of a community pharmacy, and now that doctors' offices are going with telemedicine visits and physicians are referring their patients to community pharmacies to get their vaccines and other immunizations, I think just from a patient care and a public health standpoint, I think protecting people from vaccine preventable diseases is very important during this time. And I think it'll also cause kind of a cultural change where people are seeing vaccines as an effective means for staying healthy. And hopefully they view the COVID vaccine as that as well.
Thanks, Samir. I'd like to ask Eugene and Lisa, I know we've touched upon this in various parts of the conversation, to date or to until now. But if you just had, your 3 messages that you would ask of every employer who's on this call today, what would those 3 asks be, or what would those 3 things be that you would want to communicate to folks? I'm going to put you on this. Eugene, is it okay if we start with you?
Okay, I was going to do ladies first, but I'll go. The first one is what I noticed is a lot of companies still don't have a COVID task force. They don't have a group of senior leaders that talk about messaging, communication, talk about health and safety risk and decision making. Get a COVID task force that's centered around PPE as well as vaccine tracking and distribution. The second thing I would say is, identify and develop a partner list, whether, for education or communication information, whether it's Hopkins or Giant or McKinsey or the Board of Trade. There has to be organizations that that you can go to get information about what's changing, with the vaccine. And then lastly, is, as I noted before, identify your trusted sources of supply. And so make sure that where you're receiving, the goods, that they're coming from a trusted source. And so the U.S. Customs Border Protection and the Food and Drug Administration, they have lists of trusted sources. And I think most people don't take advantage of that, but make sure that you are receiving, goods that aren't counterfeit or part of illicit trade. Those would be my 3.
It's, I guess, hard to boil it down to 3, but I think we've talked about some of them in here. First, I would say, please be a source for your employees of accurate, timely information. I think Eugene said it well, partner with whomever you need to get that information, but your employees look to you as leaders and trusted sources of information. So the more that you can play a role in messaging the important steps that can make all the difference in the world between now and when the vaccine comes, and embedding in that some messages about the consequences of not doing that, and particularly chief among them, I would say, having a healthcare system that is at risk of being overrun, And I can't think of a bigger tragedy than patients who need medical care that we usually would be able to provide and would not be able to, if we were completely overrun and didn't have staffing. So information and messaging, I think, is important. Number two, we talked about partnering with community leaders. And so whatever your business can do to help the broader community and partner with public health officials, there's just such a great need out there for partnerships and all kinds of things that you can do to help support the communities and the employees. And then third, I think, practical policies within your own business to make sure that your own policies and procedures are not somehow contributing, to sources of transmission. So using telework, thinking about your travel policies, your quarantine, your own contact tracing, or whatever you're doing to support your employees, it can really go a long way.
Thanks, Lisa, and thanks all of you. With that, I'll turn it back to Jack.
Great, thank you, everybody. Pooja, thanks so much. That was a really interesting and great conversation. Eugene, Lisa, and Samir, thank you. I think of particular interest is looking at all the intersections between the different areas that you're focused on and looking at the full life cycle and what this is. One thing that really jumped out to me here too is what's the operating environment that we're in? Somebody on the chat raised the question about, can we prioritize how things and what things get shipped? Well, who makes those decisions? We see, folks are going to the courts with, religious services. We see mask mandates going up into the courts. We see, how do we prioritize who essential employees are? And how do we, so you think about all these various components, and I think you all brought it home to us. It's just how complicated that operating system is that we need to be really, really effective here. And how are we going to think through all of those issues? And so I think the prospects look good. But we have a long way to go and there's a lot to do. And so I look forward to having you all back and continuing this conversation. I think we're sort of still at the early stages of this, but that was terrific. And just, thank you so much. And, stay well, stay safe. And I look forward to seeing you all again soon and so hopefully someday in person.